Let's turn now to the federal response to the outbreak and President Trump's efforts to reassure Americans during a White House briefing on Saturday. ABC's Kira Phillips right there at the White House covering that angle. Kira, good morning to you.
Good morning to you, too, Dan. Seeking to reassure the American public, President Trump held yet another impromptu presser to a packed briefing room here, telling us that even though a new coronavirus case has claimed the first victim inside the United States, our country is prepared for any circumstance.
In true Trump fashion, it was last minute and announced with a tweet. In response to the coronavirus outbreak that took the first American life, it was an all-hands-on-deck press conference to assure the nation there's no reason to panic. Flanked by his coronavirus lead, Vice President Mike Pence, and the rest of his COVID-19 task force, including U.S. Secretary of Health and Human Services Alex Azar, who made it clear there will be more cases here in the United States.
We have always said, from the first moment that we have spoken about this, that we would see more cases. We are seeing more cases. We will see more cases.
The president also sparring with reporters over criticism of the federal response from Democrats, calling their arguments a hoax.
We've done such a good job. The hoax is on them.
The president praising the response so far, cautioning the public that the illness is mild for the majority who have it. And on top of that,
as an important part of our efforts, on Monday I'll be meeting with the largest pharmaceutical companies in the world. Actually, they'll be coming to the White House, and we're talking about developing very rapidly a vaccine for the virus, to combat the virus.
And the head of the FDA also present at that briefing, telling us that at least 80 labs and private companies have signed on for emergency approval to develop coronavirus tests. The president also suggesting that he might have yet another briefing with us today. We'll see if that indeed happens. Eva?
All right, Kira Phillips for us at the White House. Let's bring in our chief medical correspondent, Dr. Jen Ashton, now from Newton, Massachusetts. And Dr. Jen, I think the first thing we need to talk about this morning, just what is the significance of this first death here in the United States?
Well, Eva, I think it's important to remember that even though we hear and we need to remember that it is true over 80% of cases of coronavirus appear to be mild, that doesn't mean the risk of death is zero. Those things are not contradictory to each other. So obviously, condolences to that patient's family. It is scary. We need to acknowledge that and not minimize the emotional and psychological impact that this can have on the public. And also, it's a reminder that when we say mild, that means that the risk to you or to an individual can be low, but the impact on a population level can be much more significant. And that's, I think, what this is an example of.
So what can we expect here as this outbreak continues?
Well, I think that what we're going to start to see when you look at the steps of an outbreak, you know, the first step is try to contain or stop it. When it becomes pretty obvious that that's not possible, then the step becomes trying to slow its spread. That's what we're starting to see now. And then that's really part of this mitigation phase, which is routines will be impacted. Some of them may be disrupted, and we're trying to minimize that impact. I think the other thing we're going to see is how people returning from travel internationally will be educated, will be screened, and then we're going to start to see on a local level instructions to people about what steps they should take if they suspect they may be sick. It is not rush into the emergency room unless you are having literally difficulty breathing. You want to call a healthcare provider, call the hospital emergency room, or call your local health department. They can give you the steps on what to do next.
All right, good information for us this morning. Thank you, Dr. Ashton.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.